Welcome to Speak Up and Stay Alive RadiOh with author, speaker, and your host, Pat Rouleau. Finally, someone willing and able to blow the top off hidden healthcare and hospital dangers. She's provocative, upbeat, balanced, fearless, fresh. Pat has over 20 years of experience as a professional public speaker and knows how to approach this important subject with enough humor and wit to keep you informed, entertained, and empowered. And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau, your patient safety friend, with another busy show lined up just for you, with a guest to share personalized medicine and what that means for you, and a new and fun game with Bob, Eric, and two beauties from Solia Spa. It's going to be jam-packed, so get comfy in your best listen to the radio seat, prop up your feet, turn off that tracking device, your cell phone, and enjoy this next hour with us. Because now, it's time for the healthcare hazard of the week. I just read an article that caught my eye because of the title. Here it is. For men, the most commonly reported bad reaction to prescription drugs is death. How's that for a title? Well, our guest today has some potential solutions regarding medication use and adverse reactions, as he discusses how genetic testing, by simply swabbing the inside of your cheek, can deliver important information to your doctor before he or she prescribes a drug. Information such as, are you a fast or slow metabolizer? Meaning, how well does your body process and use the drug? If the wrong drug is given or the wrong dose, you may well fall under the title of this new article. Well, now, the article goes on to say, death is the most commonly reported bad reaction to prescription drugs in men, according to information from a newly released Food and Drug Administration database. The second most common negative effect reported in men is ineffectiveness. And I'll stop at that and say, whoa, either the drug doesn't work or you die? Well, the article further states, women, on the other hand, report nausea most frequently, probably because most drugs go through the digestive system to be absorbed. And it says that women make more reports than men, 2 million versus just under 1.3 in men. And women were more likely to report more than one bad side effect, and they do the reporting themselves. Most reports for men came from their doctors or from pharmaceutical companies. But now the results should not be taken to imply that death is a common side effect because, as usual, the data is messy and difficult to interpret. Plus, more people would be inclined to report death as a side effect than they would an upset stomach. So maybe that's why death is at the top of the list. I don't know, but it doesn't sound like an exact science to me. Well, the FDA collects data on every adverse reaction to prescription drugs reported by pharmaceutical companies, doctors, and the general public. This analysis is based on a new FDA initiative called Open FDA that's supposed to make that publicly available data more accessible online. Well, even though the accuracy and comprehensiveness of the reports are unknown, there's some interesting information available, and here's a few points. First, there are more serious reactions reported for non-steroidal anti-inflammatory drugs like ibuprofen or aspirin than for any other drugs, including antipsychotics and benzodiazepines such as Valium. It's likely that this indicates how widely used ibuprofen and aspirin are, not that they're any more dangerous than any other drugs. Most of us mistakenly believe that aspirin is safe, perhaps because you can buy it over the counter. I say, think twice before popping these pain relievers. And the article states that next, in the lists of reasons that the person filing a report even took a drug in the first place, the top 2 reasons were different categories of unknown. Can you imagine reporting a bad side effect of a drug and not even knowing why you were taking the drug? Well, this statistic alone screams that we as patients must not blindly accept whatever medication our doctor doles out to us. Ask questions, take notes, Why do I need this drug? What will it do to improve my health? What side effects might I expect? Does this medication play well with my current medications? So many questions to ask and have answered. And then there's the question that the article ignores. Is death the most highly reported side effect due to the fact that some drugs are just downright lethal? Just because a doctor prescribes a medication does not mean it is not dangerous or defective. We know this. Prescription drugs are often rushed to market without adequate testing. Remember the pain reliever Vioxx? It was on the market for 5.5 years before it was recalled for increased risk of heart attack and stroke, linked to about close to 28,000 heart attacks or sudden cardiac deaths. Ads for Vioxx featured Olympic gold medalist Dorothy Hamill and Bruce Jenner. And Vioxx was prescribed to more than 20 million people. Then there's the pain reliever Darvon or Darvocet. It was on the market for 55 years before it was recalled for serious toxicity to the heart. And there are so many more. So celebrity endorsements and length of time on the market obviously are not safety standards. The FDA plans to make its databases of food and medical device reporting available for searching soon. But meantime, you can still report an adverse drug reaction to the FDA, either online or by requesting a reporting form. And I have a link on the free stuff page on the website that will take you to the FDA reporting site. Just go to speakupandstayalive.com. If you think you or someone in your family has experienced a serious reaction to a medical product, you are encouraged to take the reporting form to your doctor. Your healthcare provider can provide clinical information based on your medical record that can help the FDA evaluate your report. However, for a variety of reasons, you may not wish to have the form filled out by your healthcare provider, or your healthcare provider may choose not to complete the form. Your doctor is not required to report to the FDA. In these situations, you may complete the online reporting form yourself. But rather than get to this point, make a decision to know everything you can about every medication you take. I created the patient safety logs just for this reason. In this folder, I've included a page to record and document your medications. Now, when you go to the doctor's office or the hospital, you'll have a printout of your medications. And likewise, when your doctor prescribes a new medication, you enter it, the dose, the side effects, the reason for taking the drug in your patient safety log. I encourage you to own and order your own patient safety logs. Again, found at the speakupandstayalive.com website. Now, while the title of the article, For Men, the most commonly reported bad reaction to prescription drugs is death, it might be an eye catcher. You certainly don't want to be included in that statistic. Choose to pay attention and ask questions. Remember, you have to speak up and stay alive. What happens if you become unable to speak for yourself and are in the middle of a healthcare crisis? Wouldn't it be comforting to know that someone you know and trust, a family member or trusted friend that you named, is on your side with complete instructions that mirror what you want to have happen to you? If you do not have a properly drafted living will or healthcare power of attorney, you are living dangerously. And if you do have these documents, when was the last time you reviewed them with someone? Well, my friends Pat Schraff and David King at Schraff & King are the ones to help you. Call them right after the show at 440-585-1600, 440-585-1600, or visit them online at schraffking.com. Do you or someone you know work in the healthcare field? Ask them if they know that bacteria can live on fabric for weeks and even months. Think of the cross-contamination opportunities. Think of scrubs. How are they washed? With bleach? Oh no, that would ruin the pretty colorful designs. Most scrubs are made from poor quality broadcloth and are not bleachable. BrendaJune.com scrubs, their fabrics drape beautifully, they breathe, and they move with you as you go about your busy day. Pants, skirts, tops, Their fabrics are durable and bleachable. If you wear scrubs, you owe it to yourself and your patients to wear scrubs responsibly. Visit BrendaJune.com for high-quality, American-made, bleachable scrubs. That's BrendaJune.com. Take control of your protection today. Visit BrendaJune.com or call 1-855-668-7278. They make a great gift too. That's BrendaJune.com. You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rouleau, always on the lookout for a guest who has cutting-edge news to share with us. And I found today's guest who fits that bill while attending the Cleveland Clinic's Patient Experience Summit a few weeks ago. A nice guy stopped at my table to inquire about what I do, and of course I asked him what he was all about. He rattled off a word, pharmacogenetics. And while I knew just enough not to appear uninformed, my conversation with him piqued my interest. So long story short, I invited him to share his expertise with us today. He is Michael Seiler, who worked for a digital health tech startup in Pittsburgh and is now a consultant in the up-and-coming field of personalized medicine, mostly pharmacogenetics. And luckily, Michael is going to translate that word for us and explain why and how pharmacogenetics may help personalize our medical care. So, welcome to the show, Michael.
Thank you very much for the introduction, Pat.
Oh, you are welcome. Help us with the word pharmacogenetics. It sounds like two words mashed together, pharmacy, pharmacology, and genetics. Explain that to us.
But pharmacogenetics really takes a look at how the individual patient is metabolizing a particular medication. So similar to really how we all metabolize food differently, the same is true for medication. But really the field of pharmacogenetics ties into personalized medicine, which is the ability to treat the individual patient rather than the typical patient. And the hope is that this quote-unquote typical patient will be an archaic thing of the past, 5, 10, 15 years down the road from now.
That's interesting because I read that one top geneticist at a major drug firm estimated that 90% of prescription drugs work only 30 to 50% of the time on the patients who take them. So pharmacogenetics is an approach where all of this genetic data will be used to match the right drug to the right patient at the right dose.
Exactly. I could not have said it any better myself. And really, a lot of times when a physician prescribes you medication, they base their decision based on your family history, your overall lifestyle habits. But genetics do play a factor. It's not exactly determined how much of a factor, but it is a significant factor and something that physicians should be taking into account when they are prescribing, especially serious medications in cardiology, pain management, urology, and even behavioral health.
Sure, we can understand that if you're not metabolizing it correctly, it may not work. It may work too well, and so there could be a lot of adverse effects. How do they get this genetic data from you?
Well, what happens is a simple cheek swab. It's to the patient at the point of care. It's quick, simple, easy, convenient, non-invasive. It's not a blood test.
So you're saying they swab the inside of your cheek, a cheek swab?
Yeah, exactly. So, and actually, it's gotten to the point where these test kits are provided at free of charge to the physician so they can test you. The FedEx envelope is included with the test kit. They ship it down to one of the labs, and really results are available in about 5 to 7 days for most of these major labs today. And it gives the physician actionable insight into how they can make a better dosing adjustment based on your individual genetic makeup.
All right, so the physician doesn't have to be trained on how to interpret and read this. The lab does that and sends the results back to the physician. And then based on that, does he have to have some kind of training to understand then how to translate those results into dosing?
Yeah, great question. So a lot of these reports today, because it is such a growing field, and actually there's a pretty big knowledge gap between maybe a 60-year-old physician and somebody who's a 25, 30-year-old physician who has been studying this field extensively in medical school for the past 5 years or so, because it's got a lot more traction recently. But the reports, for example, they're all color-coded for ease of interpretation. So a physician could take a look at a particular enzyme, and they would tell the physician immediately that there should be a dosing recommendation, and it'll give them some insight into industry standards and best practices. So for warfarin, for example, there's a website called warfarindosing.org that's sponsored by the NIH, and a physician could actually go there and see more information into exactly how to interpret that metabolizer step.
Now, as a patient, can anyone request this, or is there certain conditions that would really warrant such testing?
Yeah, sure. So certain conditions I would really warn it would be anyone on Plavix should definitely have a conversation with their doctor about having a genetic test done with them first.
And Plavix,
For example,
Plavix does what?
Plavix is so essentially if you had a stent put in
Okay.
In cardiology, it helps to mitigate it and regulate from the risk that's associated with that. So, and warfarin, for example, that's a blood thinner. It's an anticoagulant.
Right.
So if you were to look at, I would highly recommend that anybody looks at Vanderbilt as someone on the forefront of personalized medicine. They have a program called Predict, the Predict program. They have tested every single one of their Plavix patients, and they found that 27% of their patients on Plavix had a genetic variation that disqualified them from being someone who's an ideal respondent to Plavix, and they've adjusted their dosage or adjusted their medication altogether. So Vanderbilt, Cleveland Clinic, Mayo Clinic, even University of Florida, they all have centers dedicated to pharmacogenetics. And really, if a patient were to want to have a conversation with their doctor, many doctors are still a little bit in the dark on exactly what's available to them just because they're so hard-pressed to see a patient every 15 minutes just to maintain profitability. Or sometimes they do lag behind the latest science and the latest information about what's available to them. So if you were a patient, you want to find out more, you could give me a call after this program or shoot me an email. I can introduce you to a few labs, or there's plenty of resources online to introduce your physician. Who
pays for this?
Yeah, great question. So if you wanted to pay out of pocket, it's not cheap, let's be honest about that. It would be about $3,000 or so to have this test done out of pocket. Now today, many commercial insurers are buying into this because, let me give you an example. Let's say with warfarin, for example, the cost of the test is $3,000, but if you have a GI bleed and you're hospitalized due to that GI bleed, the hospital cost that's associated with that, associated with an adverse reaction to warfarin, could be upwards of $15,000, $20,000. Mm-hmm. So if you look at it from an insurance company standpoint, for them, they'd much rather pay the $2,000, $3,000 to have this test done and better medicate their patients based on their metabolism versus paying that $20,000 to have that patient hospitalized. So Medicare, for example, they are covering the test regularly because it's medically necessary, especially when you're dealing with serious medications. And many commercial insurers, like I said, are buying in to having this test covered just because they deem it medically necessary, and it's a cost-saving structure for them as well.
This is a very interesting time. Then thinking about patients, are patients buying into this? Do they really want their genetic makeup documented?
Great question. There is concern out there is this lab going to share information with my insurance provider? Am I going to be somehow ostracized from my insurance provider because I'm predisposed for some sort of genetic condition? And the quick answer to that is no, absolutely not. Everything is, of course, HIPAA compliant. And all the information is always of the high security to the labs, and even the information is destroyed after a certain amount of time frame. To tell you the truth, if I were a patient, I would absolutely make sure to go out of my way to have a genetic test done on myself, just because there's so much guess and check, especially in behavioral health today, that it doesn't make sense to waste 30, 60, 90 days hopping around between medications where, in the first place, you could have found the right drug and dose the first time. I think you put that really nicely the first time you said that.
Yeah, I didn't think about that. So I was thinking about cardiac health and cancer, but behavioral health, because think of those psychotropic drugs, and if you get a hold of the wrong ones or you don't metabolize them correctly, you can head for a downward spiral, and it has everything to do with the drugs and nothing to do with your basic
health.
Exactly.
Actually, I had a really close friend of mine. I mean, let's say his name's Tom, for example. He was recently diagnosed with depression. This is really, how common this is today. I think depression has increased about 20% per year over the past few years or so. You'd be astounded by just the number of Americans on antidepressants these days. I think the number is roughly 1 in 10 or so.
Wow.
And we could have a whole other debate about whether this is a good thing that these people are finally getting treatment, or maybe the surge in SSRI prescriptions is attributed to over-aggressive marketing from big pharma companies. But like many people, my friend Tom decided to seek treatment. And, the doctor has to decide between either Prozac or Celexa, Effexor, or Zoloft, for example, just to name a few. But Tom, he was put on the SSRI. He experienced no relief whatsoever from his symptoms. And actually, I think the stat is 60% of depressed patients do not completely respond to antidepressants, and 30% don't respond at all whatsoever. So what ends up happening, like I mentioned, is this whole guess and check prescribing game. Tom would try one medication, and when it didn't work, he'd be switched to another. He said, listen, I'm suffering from depression, not stupidity. And he didn't want to waste his time jumping around. So he did some research. He came across pharmacogenetic testing. He took it to his doctor, took a couple research studies, and Tom introduced this information to his doctor and said, listen, I want a genetic test done. Lo and behold, he was a poor metabolizer of 2D, which is about 7 to 14% of the of the patient population are poor metabolizers there. His dose was adjusted, and everything was fine for him for then on.
Do you think we'll get to a point where it's just standardized? You know, when you're just a baby, they do the cheek swab and you store that genetic testing results and that information so that it's there for the future?
Yeah, sure, no question. Because your genetic information doesn't change.
Right.
Once you have it, you're stuck with it for life, really.
Yeah.
So one big barrier to that is having that tie into your electronic medical record system. That's a big barrier for health systems, especially where they say, well, if I collect all this information, what do I do with it? Mm-hmm. So it's waiting for that time to catch up with the EMRs as well.
Yeah, a lot going on with this and a lot to think about. Lots of pros and a couple little scary cons that I think people are still going to be a little wary as, all right, do I really want this information out there? But as with anything, there's risks and rewards, and you've got to balance them.
A lot of fascinating things in personalized medicine today. It's really something worth at least having a conversation with your physician or with your patients about.
Yeah, I was just going to say, where can we learn more about you, and how can our folks contact you?
Yeah, sure. So I have a basic blog set up, just a few articles. I spotlight Vanderbilt's Predict program, for example. If you go to mygumshoe.com, I'm part of Gumshoe Consulting. But you can also email me anytime at mike@gumshoeconsulting.com. Or honestly, give me a call. I'll talk to anybody. And my telephone number is 610-220-7861. I'm happy to spread the word and share knowledge.
Well, Michael, it's been a pleasure to learn more about the future of healthcare, and please stay in touch and share any new findings with us, and you're always welcome on our show.
Yeah, have a good weekend.
All right,
absolutely.
You too. Thank you. Let's spend the next 2 minutes with Hari Khalsa, a healthcare advocate who is highlighted in my book, Speak Up and Stay Alive. Hari helps people just like you throughout the country whenever you have a healthcare-related question. Welcome to the show, Hari.
Thank you, Pat. It's always so wonderful to be here with you and your listening folks.
Yay, we love having you as well. Well, now, many times a doctor or a group of doctors come up with a treatment plan that is difficult for the average person to understand or even comply with. How can you help?
This is one of the areas that I think I can be most beneficial for people. Because being a nurse practitioner, I really understand the medical side. I understand the medications, I understand the diagnosis, and I understand the goals that the doctors are talking about. The other reason why I can be helpful is because sometimes I can pick up the pieces that are missing in the treatment plan. And what I can do is I can talk to the doctors. I can say, look, you haven't talked to this doctor, and the treatment plan isn't whole. We need to coordinate all the pieces so that the person knows that they're getting everything they need with their treatment plan. And I can also take a look at the medications, because you'd be surprised that either the medication list isn't in one doctor's notes, it's not complete, another doctor may have really old medications. And so what I can do is look at the treatment plan and say, no, this person is actually allergic to this medicine, or this medication was stopped a long time ago. It's important to have somebody help you look at the treatment plan and know that it's the right treatment plan for you. So that's what I like to do, and that's why it's really good to have someone like me, because I do understand the medical side, and I can help you understand it as well as communicate with the doctor when you're having problems.
Yes, and you're really good at what you do, so I really encourage folks from around the country, they can contact you. You don't have to be in their neighborhood. You can still work with them via phone.
So wherever you are, I'm here.
Hari, it's always a pleasure to talk with you.
Thank you so much, Pat.
All right, folks, now you don't have to be alone during a healthcare crisis. Hari is available to you and is just one phone call away. Call her to discuss and solve your healthcare needs. It's 1-866-980-4325. 1-866-980-4325.
Go ahead. Say something.
Something.
Check.
Okay, I got it.
Wise guy, right?
Okay.
All righty, we're rolling?
Yeah.
All right. You're listening to Speak Up and Stay Alive, Patient Safety Radio. I am your hostess, Pat Rouleau, and author of the book, Speak Up and Stay Alive, the Patient Advocate Hospital Survival Guide, which you can purchase online at the website speakupandstayalive.com, or you can call me directly if you don't have internet access and order by phone, 440-725-5462. And now it's for the fun portion of the show. And we've got a fine crowd of people here today, and we're going to play a brand new game called Speak Up and Stay Alive, Ask It Basket. All right, let's see who we have here. We'll start right to my right.
Hi, Lisa Stewart from Solia Spa.
Melody Carl from Solia Spa.
Yay.
I'm Bob, former financial planner and developer out of East Tennessee.
Yay, Bobby. And
I'm Eric. I'm a regionally famous radio producer from Northeast Ohio.
yay, Eric. And Eric is in the sound booth today, so we're going to have to draw the little colored cards out for him. Here's how this game goes. I'm going to read a question from the Squeak Up. I'm in a different show, folks, with the Speak Up Ask It Basket. And all of our studio guests here will have to see if they can answer the question. So now we've got different categories. We've got one called infections, injections, and other imperfections. Kind of self-explanatory. We've got word nerd. Okay, so you're in the hospital, you're going to hear some words and phrases that you might be unfamiliar with. So we're going to bust that myth today. We have truth or quack, basically a statement that is either true or false. We've got a dose of gross, where the answer just might be a little yucky. And finally, we have when dangers are strangers. Again, another self-explanatory one. So are you radio rivals ready to begin?
Ready.
Yes.
Let's go for it.
Ready as I'll ever be.
All right, last time Lisa was here, she won.
Yes.
All right.
She's number one.
She's looking a little competitive today. All right. Yes.
She's always competitive.
So true.
Oh, my. And we're going to go around the room, and each of you can pull a category from the Ask It basket. So let's see. Let's jiggle it around. Let's see what Lisa picks out. What does it say?
Infection, injections, and other imperfections.
All right, Lisa, you can.
What I wanted to know. I hope I did it right.
You can try. If not, that's okay. We'll try to pitch in and help you. All right. The first, Speak Up and Stay Alive, infections, injections, and other imperfections. To be proactive when it comes to hospital-acquired infections. Before you go to the hospital, inquire about the hospital's what?
Oh, God, I used to be a hospital pharmaceutical rep. You want to know about, let's bring back the days. Yes, their infection rate. I forgot.
Yay!
Because that's how it spreads. What's their staff rate?
No cheating.
I know, it's just been a long time since I talked about that kind of stuff. Yes, definitely find out their infection rate.
Absolutely. And ask to meet the person who manages it. Choose a primary care doctor with admitting privileges at the cleanest hospital and let your doctor know that you will be diligent about monitoring infection possibilities. And our website has lots of helpful resources on the free stuff page. Just go to speakupandstayalive.com. How's that for a little plug? Yeah.
You got it.
All right. Next, we've got Melody.
I got word nerd.
Ooh, word nerd from the Ask It basket. All right. Our first, we'll pull it out of the pile here. The first word is pulse oximeter. Do you know what that is?
I do, actually. It's the little gadget that goes on your finger, and it reads the oxygen level that's in your blood.
Hooray! We need to all hooray for her.
Oh my God, where did she come from? Where did she come from?
That is right. It's like that little Band-Aid that they put on your finger with a little red light, and it's taped to your finger to measure the oxygen level in your blood. That is awesome.
Yay.
We love Melody.
I'm glad I didn't
She's
get that one.
Me too.
Ox? Is that some kind of an animal?
Yeah.
All right, Bobby.
Oh, I'm afraid to look. Okay. Oh, is this truth or quack?
Yes, truth or quack from the Ask It basket. Basically, it's a true or false. All right, Bob. Your doctor says physical activity during youth may help reduce fracture risk in old age. Is that a truth or is it a quack?
I'm going to say it's the truth.
Yeah? You guys
Yeah.
agree?
Yes.
Absolutely.
Yeah? All right. It is true. Exercise intervention in childhood may be associated with lower fracture risks as people age due to the increase in peak bone mass that occurs in growing children who perform regular physical activity. So kids, put down your cell phone, step away from the TV, go outside, and run around. Yeah? Kids chasing.
Don't chase cars.
Women.
Chase cars. Okay. You like the dog. Choo.
Oh my God. The show gets weirder all the time.
You gotta have a little fun in it.
All
My
right.
gosh.
Eric, I'm going to draw for you, okay?
Okay.
All right, since Eric is in the isolation room, not for any healthcare reasons. Okay, you got word nerd. You up for that?
Ooh, after hearing that first word, I don't know.
All right, I'm gonna. None of them look too easy. Next word is intubated. Ooh. Oh my, he's got all kind of random thoughts going into his mind.
Honestly, I have no idea.
No idea. Does anyone here know what intubated means?
A tube.
Yep.
Down your throat so you can breathe.
Tube down your throat. After you're asleep in the operating room, a tube will be inserted into your lungs. The tube is then attached to a machine that will do the breathing for you. And while the tube is in, you will be what's called intubated. It allows your heart and lungs time to recover from your operation without having to do all the work. Eric, you got to listen to Speak Up and Stay Alive, right?
Eric, be ready.
Now I'm glad that I didn't know that, because I didn't like the sound of that. I know that's necessary.
Give Eric another one. Let him start this round again.
All right, you got another one. Let's make sure it's not word nerd. Oh, okay. Eric, you've got when dangers are strangers. That sounds a little bit better. Let's see what we have here. From the Ask It basket. When this danger is a stranger, a patient will develop a small tear in the skin that can quickly become this.
Bed sore?
Yes!
Yeah.
Yay! Yes!
That's good, Eric. You got that one.
It's also known as a pressure sore or a pressure ulcer. So that makes it very important to change positions at least every 2 hours. Very, very good. Glad Eric redeemed himself. Now we've got Lisa.
When dangers are strangers.
Ooh, another one. All right, Lisa. When this danger is a stranger, your current nurse will be replaced with a new nurse. And this dangerous time is called a shift change.
Yes, shift change.
Shift change, or better known as there's another name for it.
I should know this. One of my best friends is an ICU nurse. I got nothing. Sorry.
Any other takers? The handoff.
The handoff.
Oh, right, because the new person coming in is not familiar with your chart.
Yeah, the handoff.
It's serious. They need to know.
Exactly.
Yeah.
The handoff is a time when miscommunication will most likely occur. Anytime information crosses lines, either between people or locations, this is an important time for the patient's advocate to be available and on site to see to it that proper information transfers from one person to another. But you were right. Shift change is one of the handoff times. When you go home, discharge is another dangerous handoff time. When you transfer from facility to facility, from floor to floor.
Right.
Yeah, anytime like that happens. All righty. Melody.
When dangers are strangers.
We are on a roll. Okay, here we go. In the early stages, when this danger is a stranger, and especially during or after a hospital stay, you may notice small red bumps on your skin that become red, swollen, and painful. What should you rule out?
Like a staph infection?
Yes, you got it. Yep, like MRSA.
Okay.
You got it. Yep, a staph infection. You may also develop a fever as your body tries to fight off the infection. More serious signs of a staph infection can be chest pain, cough, fatigue, headaches, muscle aches, and shortness of breath. Be mindful of MRSA infection both in the hospital and in gyms or where people share equipment.
Yes.
And we talked about that one other time when you were on the show about manicurist and getting your nails done.
Yes, absolutely.
Highlight that again for us.
At their station getting your nails done, you have to really watch their files, because even something as simple as a nail file being used on a person with a staph infection or MRSA can transfer that to you because it gets into your nails. If you have a small cut, then you touch your eye, your mouth, any opening, then it gets into your body. And if your body can't fight it off, then you will get that infection also.
So very important to go to a spa that practices very, very safe and clean hygiene, as
Absolutely.
you do. You said you have hospital grade
disinfectants. Yes.
There you
yes,
go.
Definitely. And if you don't see them, ask to see them.
Well, just go to Solia Spa and you don't have to worry about it. All righty, Bobby.
Oh, gosh. Let's see what I got here. A dose of gross. This is going to be something.
A dose of gross. All right, Bob. Up to 1 in 5 people on antibiotics stop taking their full course of antibiotic therapy due to this gross answer.
Oh, that's called diarrhea.
Yes. Yay.
Diarrhea.
That's right. It's a shockingly true statement. According to a study by researchers at Albert Einstein College of Medicine, many folks simply stop taking their full course of antibiotics because of dreaded diarrhea. Now, antibiotics target bad bacteria, but they may also kill the good bacteria in the large intestine, and that's what leads to diarrhea. Physicians could help patients avoid this problem by prescribing probiotics. We've talked about this on the show before. The effects of probiotic doses are short-lived, so they should be taken throughout the course of antibiotic therapy. They will not diminish the effectiveness of antibiotics. Do you guys know about this?
Absolutely. I used to sell antibiotics a long time ago.
That's
and
right. You
it
were a
disrupts-
pharmaceutical rep?
And it disrupts your normal flora. So it's your little ecosystem in your gut is just thrown off when you take an antibiotic.
Right. It doesn't know the difference between good guys and bad guys.
Right.
It
So
kills
it
it all.
destroys everything.
That's the reason you need the probiotics.
Absolutely.
Absolutely.
Yeah.
All right. I'm going to pick for you, Eric. Eric, you got infections, injections, and other imperfections. From the Ascot Basket. All right. You're going to get this one, I know. Many healthcare-acquired infections could be avoided if everyone did this.
Everyone did.
Eric?
I don't know what you're doing with your hands.
Clearly, you're not doing it. You're really infected.
No, is that washing your hands or hand sanitizing using the alcohol?
Either.
There you go.
Either.
We're all sitting in here rubbing our hands together.
I have to wash my hands now.
It's like, what's wrong with these people? Yes, actually, a simple solution to such a widespread problem,
Yes.
right? We shouldn't be having these kind of things.
No, and that's something we do every single time we have a client. We make sure we wash our hands right in front of them so they know before we do a service. It's so important.
Isn't that so obvious? I mean,
You would think.
And it's so quick too, you know.
so before someone does a facial or you do a massage or before you do a manicure or pedicure,
Yeah.
you
Do you
wash
all-
your hands.
Do you all sing happy birthday twice?
No.
I
You need
sing
to.
ABC.
Sing happy birthday.
I was taught ABC.
Whatever you want to sing, just sing it long enough that you get those hands clean. All right, that was good. We're back to Lisa. What did you get?
Word nerd.
Okay, word nerd. Since you guys are so good at this, we're going to give you a difficult one. NG tube.
NG. Noxious
Melody's
gas.
like noxious
Noxious gas.
Nasty guys.
I would have to say it's something that goes through your nose, up through and down into your chest, to your
Oh,
stomach.
very good. Yes, it's the nasogastric tube. The
Called
N-
cheating.
My excellent associate, Melody, told me.
Good
She's
thing
so
this is
good.
radio. People can't see all the hand gestures going on in here.
Melody is the expert.
Yeah, sometimes you'll hear the nurse come in and say, oh, we're going to put in the NG tube. It's like, well, okay, what is that? NG stands for nasogastric, naso through your nose and into your stomach. It will be inserted through your nose to your stomach to keep the air from collecting and also to keep your stomach empty. This will usually be done after you are asleep in the operating room. When it is in place, you will not feel anything, and the tube will be taped to the side of your nose and cheek to keep it from slipping. If necessary, you can also be fed through this tube. So many times if you see somebody with that, now you can be really cool and talk about their NG tube.
You got it. Okay.
All right, Melody.
I got a dose of gross.
All right, back
Oh,
to
there we go. You like that one.
All right, when your body detects the food you ate has some type of toxin in it, like bacteria, you will do this gross answer.
Vomit.
Yes, vomit. Gotta love this show, people. Bacteria, virus, fungus, or some other toxic poison that is allowed to enter your digestive tract can cause you serious harm and maybe even kill you. So your body detects this poisoning. The food is reversed, regurgitated, and your body causes you to vomit or sometimes have diarrhea. That is why medications to make you stop vomiting or to stop diarrhea actually goes totally against what your body is trying to do to save you. In fact, most chemical medicines in an attempt to make you feel more comfortable, like cough suppressants, fever reducers, diarrhea medicines, and vomit reducers, I guess, go totally against what your body's trying to do. So throw up and enjoy it.
Sure.
Yeah?
My daughter is 2, and she calls it spilling out.
Oh.
It was the first time that she ever thrown up, and she goes, "Mommy, I spilled out." And we're like
I like that.
cracking up, you know, and I'm like, "Oh my gosh, I'm so sorry. It's okay." But now it's like this whole thing, like when you don't feel good, like, "Oh, I think I'm going to spill out."
I think I'm going to use that. It sounds better than
Sounds
vomit,
sounds better
doesn't
than
it?
anything. Oh, we're getting down.
Bob, we're getting down here.
Oh, another dose of gross.
you keep getting them, Bob. All right, Bobby, you are in a hospital or healthcare setting. You suddenly get recurring diarrhea. You just might have a dose of this gross answer.
C. diff.
Yes, Bobby.
C. diff, right.
Yes, C. diff. C. diff bacterium takes hold typically in a hospital, rehab, or nursing home setting and is spread when people do not wash their hands properly, like we just talked about, and especially if you've taken recently antibiotics. So this is all connected. A dangerous and deadly situation. And remember, hand sanitizer does not kill the C. diff bacterium, only good old-fashioned soap and water.
You got it.
Yeah. You guys familiar with C. diff in any way?
Absolutely.
And sing
Yeah,
happy
that's
birthday
dangerous.
twice.
Yeah. Thank you, Bob. How do you?
C. diff rates at hospitals, very important to know too.
Yes. So it goes back to that one question you have when you're asking
Absolutely.
about the infection rate. Talk to them about their C. diff and MRSA rates. Yeah.
Definitely.
Excellent. All right, Eric, I'm picking one. All right, random purple. Truth or quack?
All right.
All right, Eric, your medical records are private and you may not get copies. Is that the truth or is it quack?
I never had the occasion to ask for my medical records, but I'm going to say that's hopefully quack.
Hopefully it is quack. It is quack. Yes. There are state and federal laws, Eric, that protect your right to request and receive your medical records on a timely basis. So please, folks, take advantage of this right that you have and ask for copies for everything in writing. And then once you get them, make sure that everything is correct. Actually, I think in the state of Ohio, you have 30 days by law to get those records. If for some reason they can't get it to you within 30 days, they have to give you something in writing and then it can extend it for another 30 days, but maximum 60. So if you go right in and let them know, I know that you have to have this to me within 30 days, you're basically putting them on notice that you know what you're talking. Got to know these things. Yeah?
You got it.
All right, we're getting down there. Lisa.
Word nerd.
Word nerd. All right. All right, Lisa, we've got one for you. Foley catheter.
Melody.
Melody, do you know this one?
I do.
Okay. Why do you know so much?
Because I used to work in a hospital.
Oh,
so as
there
a
you go.
patient care assistant.
Okay.
So.
Tell us the Foley catheter.
It's that lovely device that's inserted into your urethra so that you can't get up to go to the bathroom. So they use it for surgery, during labor. Basically, it goes up into your bladder and it collects the pee in a bag that's next to you, and somebody comes and drains it.
Absolutely. A Foley catheter. You are right on. Can't get any better than that. Small tube that is inserted into your bladder to drain out the urine into a bag that's attached to your bed. Many times you'll see that attached to your bed. This allows the doctor or nurse to measure how well your kidneys are working. And a couple little tips. Make sure that that bag is always lower than your kidneys so that it's not flowing back. And also ask every day when that can be removed, because that is a hot spot. It's a real source for infections. That
That's
catheter.
probably the number one infection besides washing hands.
Yeah.
It
UTIs.
is. It is. So ask every day, do I still need this? A lot of times they keep it in just for the convenience of the nurse. Guess what? There's no call button to run to the bathroom if you've got a Foley catheter on.
Yeah.
So, yeah. Well, now you get another one.
I'll give this one to Lisa. Infections, injections, and other imperfections.
All right. Here we go. It's okay if your nurse reuses a needle or syringe to give you an injection. It saves on your cost of supplies.
No, absolutely not.
No, absolutely not. Patients need to be very aware of this very serious threat to their health, the reuse of needles and syringes, and the misuse of medication vials. Healthcare providers, doctors, nurses, and anyone providing injections should never reuse a needle or a syringe from one patient to another or withdraw medicine from a double-use vial. And this is especially important because I've heard many horror stories about this. People going to drugstores and health fairs and getting injections and vaccines, and the folks that are doing this aren't even licensed. So be especially mindful when you're doing something that's not in a very clinical office.
Absolutely.
Yeah?
Yep,
Definitely.
you got it.
All right.
Well, come out of there, you little rat. Oh, gosh. Infection, injections, and other what?
Imperfections.
Imperfections.
All right, Bob, I hope you get this. Carry this in your pocket when you go to the doctor's office or when you first check into the hospital.
Your pen.
Yeah. Whoa, that was
fast,
Bob, yes.
I've lived with you too long. I know what's going on.
On fire.
How many sick patients sign in at the doctor's office or fill out their hospital admissions with the same pen? So start your doctor or your hospital visit making infection control your goal. Yeah?
Yeah.
All right.
Didn't even think of that.
Last one. Oh, man. Word nerd for Eric from the Ask It basket.
I can always.
Oh, that's right.
Because I like these ones.
Oh, you heard that,
Melody,
Mary.
Melody will help you cheat. This is an abbreviation. NPO. NPO stands for... I'm not going to expect you to get this. But take a stab.
I got nothing.
I know. I would have nothing
Nerd
either.
put off.
What it means is that you can't have anything to eat. I don't know what the N, the P, or the O stand for, but it just basically means you can't have any food or drink because they've got to do a test or just clear out your body, whatever it is.
Absolutely. You were so good. I remember being in the hospital with my mom and some nurse came in. She goes, well, she's NPO. I'm like, oh my gosh, I hope she's going to live. Like, what's NPO? It's a Latin word, nil per os. That means nothing by mouth. And you're right. Your doctor will give these orders usually 6 to 8 hours before an operation, and it means you cannot eat or drink anything at that time. And this is ordered so that during surgery, it keeps you from choking.
We learned something.
We did learn something. Well, guys, I thank you so much for indulging in
You're
dipping
welcome.
into the Ask It basket.
It was fun.
It was fun. Bob, thank you for being
You're
here.
quite welcome. I'm glad I'm here.
Eric, sorry it was challenging today, huh?
That was
Grueling. And no naked mole rat question.
No, none.
Thank you, Eric.
You're welcome.
Melody, thank you for joining us. You really were the highlight here. You knew these answers.
He's
Thank you.
amazing.
Thank you.
Lisa, thank you.
Thank you. Thank you for having us.
It's our pleasure. Now tell everybody where they can find you at Solia Spa.
Solia Spas in Brecksville. Our address is 6909 Royalton Road. And you can also find us on the internet, soliaspa.com.
And thank you, everyone, for indulging our silly side today.
You're quite welcome.
Thank you.
All right. And stay tuned, folks. There's so much more. Patient safety tips and tools on Speak Up and Stay Alive, Patient Safety Radio. Thank you, guys. You're awesome. Dipping into the Ask It basket.
You
did
so good. Oh, my God.
It was fun. That was a different game.
It was.
She always comes up with something
Very
crazy.
creative. Ask It basket.
It was fun.
When it becomes necessary to seek in-home assistance for a senior family member, success hinges on finding just the right caregiver in your area. But where do you go? How do you start? Well, I have the answer. Senior Helpers. At Senior Helpers, they match caregivers to clients based on their specific personalities, experience, and skill sets. And they have a proven track record of hiring compassionate and dependable employees. Senior Helpers understands that this life stage can be a major change to a senior's lifestyle. And for them to continue to feel happy and independent, they must be completely comfortable with their caregiver. I know about this as I went through it with my mom. Allowing a caregiver into your loved one's home is a major decision that requires ultimate trust. Thanks to Senior Helpers demanding hiring requirements and stringent local supervision, you can feel 100% confident in every staff member they place. Senior Helpers hires caregivers based on their professionalism, enthusiasm, and compassion for seniors. Each and every caregiver is hired and employed by Senior Helpers and never subcontracted. They're bonded and insured. They're thoroughly screened and evaluated in person. If you or someone you know has a need for assistance, whether long-term or short, give Senior Helpers a call. They're local and serve Cleveland, Akron, Canton, and Medina. Call them today at 1-877-922-STAY. S-T-A-Y. That's 1-877-922-STAY. Make Senior Helpers your first call.
We were surprised when Dad brought up hospice care. I thought you called when you were all out of options, but Hospice of the Western Reserve has been helping care for Dad for some time now. I'm so glad we called when we did. Their support has given us quality time I'll remember forever.
With Hospice of the Western Reserve, you can choose when, where, and how you receive care. Discover why the hospice of choice is Hospice of the Western Reserve at hospiceofchoice.org.
You're listening to Speak Up and Stay Alive, Patient Safety Radio, every Saturday morning in Cleveland, Ohio, and every Sunday on 23 additional stations throughout the country. Plus, you can hear us on demand on iHeartRadio. Just go to iHeartRadio.com and enter Speak Up and Stay Alive. We're also on the Entertainment Network during the week, and always you can find the current week's show as well as all of our previous shows at our website, speakupandstayalive.com. We're also on the XDS Cumulus satellite for all radio stations throughout the country to pick up. So if you have friends or family in another city or state and would like for them to hear the show, have them call their local programming director. And it's simple. Just grab the Speak Up and Stay Alive radio program from the XDS Cumulus satellite. If they have questions, you can always contact me at 440-725-5462. I am Pat Rouleau, your hostess and author of the book Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide. Available at all of our live speaking events or at our website, speakupandstayalive.com. And I do encourage you, if you are part of a group, club, business, church, or hospital, to invite me to speak to your crowd. Even though the topic of healthcare and hospital safety is quite serious, we do make our presentations fun, fast-paced, interactive, memorable, and life-saving. I can guarantee that I won't be monotone or slow, and you won't get sleepy or bored. I'm a bottom-line, fast-moving gal with lots to share, so call me or email us at speakupandstayalive.com or call me 440-725-5462. Now, if you missed some of today's show, you are certainly living on the edge. When you join us each week, you may be adding years to your life or to the life of someone you know and love. So tell your friends about this program. Don't be a radio hog. And be sure to listen next week as we continue to inform and entertain, all the while keeping you safe during every healthcare and hospital encounter. Same time, same place, but never the same information. Until then, I hope you have a healthy and a happy week. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
The information provided in today's broadcast is for informational purposes only and was not intended for use as diagnosis or treatment of a health problem and should not be considered as medical advice. Want even more information? Purchase a copy of Pat's book at speakupandstayalive.com. Or you can call Pat at 440-725-5462. Until next week, remember, it's okay to ask others to wash their hands. You have to speak up and stay alive.